As the government shutdown extends into its 29th day, Americans who depend on coverage through the Affordable Care Act are getting their first look at the health care sticker shock. Access to the new ACA premiums were released on Tuesday. According to the health policy group KFF, the average cost is jumping 26%. And without the government subsidies, the out-of-pocket costs will go up even more. For tonight's interview, we are joined now by Larry Levitt, KFF's Executive Vice President for Health Policy. Mr. Levitt, thanks for joining us. So let's start with this. How much more could people have to pay if these credits are not extended?
Yeah, so if these enhanced tax credits are not extended, ACA enrollees will see their premiums increase by an average of 114%. So for viewers who haven't been in math class in a while, that means premiums are going to more than double in terms of what people pay. And that'll be an increase of over $1,000 a year on average.
Why are insurers charging so much more for health care this year? Is this the norm? Is this out of the norm?
So the amount that insurers are charging is outside of the norm. It's higher than it's been in recent years. As you said, the average increase in what insurers are charging is 26%, and that's been the biggest increase in recent years. So it's a number of factors. One is just the cost of healthcare is going up. Hospital prices are going up, like the prices of so many things. GLP-1 drugs for weight loss, many more people are using them. That's increasing costs. New drugs are coming on the market. So that's kind of increasing healthcare costs across the board. But there's one thing in particular that's happening in the Affordable Care Act marketplace, which is if these enhanced tax credits expire, millions of people are expected to drop their coverage. And most likely the people who drop their coverage will be people who are healthier than average. So that will leave a sicker pool of people for insurers to cover, and that's driving premiums up.
That's kind of a worst case scenario. What if the tax credits are extended? Will things still change?
So if the tax credits are extended, what people will pay out of their own pockets will stay largely the same. The premiums are based on your income. So the lower your income, the less you pay. The higher your income, the more you pay. And if those enhanced tax credits are extended, that will remain in place. Now, of course, that will cost the government more, over $30 billion more per year, but it'll save people a lot. And as I said, if those enhanced tax credits are not extended, people's premiums will end up doubling on average.
How many people are we talking about if the costs go up, if they get higher? How many people across the country?
So 24 million people across the country who get their insurance through these ACA marketplaces. These are people who are not covered by Medicare, not covered by Medicaid, don't have insurance through their employer. 22 million of those 24 million get these tax credits that help them pay their premiums. So 22 million people would be hit with these out-of-pocket premium increases. You know, it's a minority of the public, but it's people who are particularly vulnerable. These are, many of them are small business owners or work for small businesses. That's about half of them. Small businesses typically don't provide health benefits to their workers. It's also, gig workers, Uber drivers, DoorDash deliverers, farmers and ranchers rely on this coverage in particular because they're not working for an employer.
Could people end up losing all of their health care as a result of all of this?
They certainly could. I mean, the Congressional Budget Office, which is kind of the budget referee in Congress, estimates that nearly 4 million people would end up uninsured if these enhanced tax credits aren't extended. So those are people who will have no health insurance whatsoever. Now, they may be healthier than average, but things happen to them. They get sick, they get in an accident, they end up in the emergency room, and that will have ripple effects throughout the healthcare system.
Okay, real quick here. One more thing here, sir. Why would healthier people just drop out of that marketplace?
Yeah, I mean, if you're sick and you have substantial medical bills, you're going to find a way to pay that premium. You'll cut back on other things. You'll put bills on your credit card. You'll dip into savings. You'll figure out a way to keep that health insurance. If you're currently healthy, you're more likely to roll the dice. You're going to make sure you pay your rent, your food bills, your utility bills, and health insurance may be kind of lower on your priority list.
Especially if you're younger. All right, Larry Levitt from KFF. Thank you so much for the insight.